What if the greatest barrier to curing a disease wasn't the medicine, but a myth? Today, we have the cure for leprosy in a simple blister pack. It is free, it is effective. But in 2026, as we observe the World Leprosy Day, the World Health Organization is highlighting a hard truth in our theme. Leprosy is curable, but our greatest challenge isn't biological, it's the stigma. To fight this ancient burden, we must first understand it. Leprosy, also known as the Hansen's disease, is a chronic infectious condition caused by the bacterium Mycobacterium leprae. For thousands of years, it was misunderstood as a curse or a divine punishment. But in reality, it is a slow-growing infection that primarily targets the skin, peripheral nerves, and the eyes. Transmission is not as easy as many believe. You cannot catch leprosy from an handshake, a hug, or sitting next to someone. It is transmitted through droplets from the nose and mouth during close and frequent contact with untreated cases. When the bacteria enters the body, they affect the nerves. If left untreated, this leads to a loss of sensation, which is why injuries go unnoticed and eventually leads to permanent disability. Every year, the world pauses for World Leprosy Day, which always falls on the last Sunday of January, to celebrate the resilience of survivors and refocus our effort on eradication. Our mindset is ending the burden, inclusion for all. The very essence of this day is to remind us of our goal: 000. Zero transmission, zero disability, and zero discrimination. For too long, the world didn't just fear the bacteria, it feared the person. We built walls of isolation that still exist in our minds today. To my fellow Nigerians and health professionals, stigma is why a father hides his symptoms until it's too late. It is why a child is turned away from school. Stigma causes people to lose their jobs and their homes, not because they are sick, but because we don't understand. We have the MDT, multi-drug therapy, but we need a world where people feel safe enough to ask for it. The medicine exists, but it cannot heal a social wound. Our task is no longer just a medical one, it's a human one. We must replace isolation with inclusion and silence with education. When we choose compassion over fear, we do more than treat a patient. We dismantle the final obstacle to eradication. The cure is in the blister pack, but the end of the disease is in our hands. Together, we can turn the page on this ancient burden. Let us make 2026 the year we stop fighting the person and start finishing the fight against the disease. Let's end the stigma and achieve zero leprosy. This message is brought to you by the PharmaStreamTV. You can follow our YouTube channel by subscribing and clicking the notification bell icon for other health-related matters. I am Goodness Akitunde.